So the symptoms of gastroesophageal reflux disease are heartburn, regurgitation, difficulty swallowing, pain in the chest, coughing, hoarseness, repetitive pneumonias, and anemia. So the three most common symptoms are heartburn. Heartburn is a burning sensation in this part of the chest, mainly after a meal. Regurgitation is when the acid comes all the way up to the patient's mouth. It usually happens at night when you're sleeping and wakes you up with a choking sensation. And the other common symptom is difficulty swallowing. We call it dysphagia. So people, while they're eating, they feel that the food gets stuck right here in the lower aspect of the chest. Reflux disease is treated first with medications, which is called PPIs, which decrease the incidence of acid in the stomach. When this fails, the next option is a surgical approach, mainly to recreate a valve to prevent the acid to go up into your food pipe. There are mainly two options. One, recreate a valve with your own stomach by wrapping it around at the end of your food pipe. The second surgical option is the links, which are magnetic beads that they will recreate a valve in the lower aspect of your stomach. These two procedures can be done with a minimally invasive technique with the aid of the robot. We make little incisions in the belly and we perform the procedure through those. The post-operative care, because of the minimal invasive approach, will be less pain, faster recovery. You can actually go home the same day or the day after the surgery. There gotta be a little eating habit changes, especially with the links. You're gonna have to eat repetitive meals to avoid the scarring on this implant. With the fundoplication, wrapping the stomach around your esophagus, you basically have to change your diet by gradually increasing the type of diets. First with liquids, then with soft mechanical diets, this baby food consistency, and at the end, after the third week, regular diet. The surgical approach, what it's gonna do is gonna avoid the patient to take medication for the long term. And as we know, there's some side effects for medications in long term. Outcomes with the LINX procedure are very impressive. Around 90% of the patients will stop suffering from heartburn, and around 95% of patients will stop suffering from regurgitation. And around 85% of the patients will stop taking daily medications for heartburn. The advantages of anti-reflux procedures are several. One of them is that the patient stop taking long-term medication. Second one is they can sleep without any pillows or in a recliner, which will allow them to have a better sleep and be more productive at work. The other thing that the patients liked a lot is that they can start having regular food without any heartburn symptoms. So if you're suffering from reflux disease and believe that you're a candidate for surgical repair, don't hesitate to call Carroll Surgical Group at 770-834-3336.